All right, we're live.
Welcome to The Future Inspired by You, a donor impact series brought to you by Spectrum Health and the Helen DeVos Children's Hospital Foundation. I'm Tim Fagan, a member of the Executive Committee of Helen DeVos Children's Hospital Foundation Board of Directors, and I'm so pleased to introduce this new monthly event to showcase the many inspiring programs and stories at Spectrum Health and Helen DeVos Children's Hospital. Our generous donors make these programs possible and support our efforts to advance health and innovation in our community. To start things off, I'd like to introduce Tina Fries Decker, President and CEO of Spectrum Health. After Tina, we'll hear from Dr. James Bonner, Division Chief of Pediatric Hematology Oncology at Helen DeVos Children's Hospital. We'll finish up with a chance for you to ask questions, which can come in the form of comments in the social media platform that you are currently using to watch this presentation. So Tina, I'll turn it over to you.
Thank you so much, Tim. And we're very excited to be with you today. Boy, it's been a year. It's spellbinding to see how dramatically and rapidly the world has changed this year. In early January, U.S. market stood at near record highs, and the unemployment rate was 3.6%. Almost none of us would think to wear a face mask on an airplane, let alone a trip to the grocery store. Now, flash forward, and our lives have shifted in ways both big and small. Mask wearing is widespread. The way we learn has changed, and we are traveling closer to home. The way we work has also evolved as many businesses adapt to working remotely. And those who can't work remotely, whose jobs are deemed essential, face additional risks every day as they work to provide needed services to their fellow community members. From grocery store cashiers and bus drivers to mail carriers and police officers to thousands of dedicated healthcare workers at health organizations like Spectrum Health, these essential workers put their own health and safety on the line to support the health and safety of others. Day after day, I watch our doctors, our nurses, care team members put on their PPE, personal protective equipment, to do the work that cannot wait, from delivering babies to administering cancer treatments. And I reflect with pride and gratitude on all that makes that work and care possible. Make no mistake, our frontline workers are not the only ones who are essential. So are you. Thanks to your generosity, you are right there on the front lines with us. We simply couldn't do what we do if you didn't do what you do. And so on behalf of the whole team at Spectrum Health, thank you so very much. The coronavirus pandemic has challenged all of us. However, looking back, what stands out to me most is the strength of our relationships that have enabled us to move mountains. With creativity, generosity, collaboration, and courage together, we met and exceeded each challenge. From finding new ways to clean our N95 masks, to finding businesses that could make disinfectant wipes and hand sanitizer, to people caring every day to provide meals to our team members. The way we all rallied together to find solutions was awe-inspiring. Battling the pandemic has been intense and difficult for each individual team member and for our overall organization. But there has been something of a silver lining to this experience, since it has accelerated changes underway, such as telemedicine, curbside services, and investments in our team. Once the pandemic passes, and I know it will, I am confident that we will have leapfrogged 2 to 3 years ahead toward our vision of personalized health made simple, affordable, and exceptional. The progress that is being achieved positions us for our future, and I would like to highlight your impact and the vital role you play in making it all happen. Our Ready For You campaign underlines our commitment to infection prevention and providing safe ways for you to receive care. From providing masks and introducing more cleaning cycles to installing robotics, there are many things we are doing to cut down on disease transmission. For example, in our new C-section rooms, we have an Indigo Clean Light, the first of its kind at Butterworth Hospital. And this machine uses visible light to safely, automatically, and continuously kill bacteria. We are continuing to pilot new ways of delivering our services without sacrificing quality and caring. Some examples of this are our curbside flu shots, curbside urgent care, and curbside cancer services. We will soon be implementing processes to alert us when you may be on the way, enabling you to skip the registration area and go right to the room, eliminating the wait. This is what we mean when we talk about making healthcare simple. Digital services have transformed healthcare in the last 6 months. In 2019, we did 20,000 virtual visits, making us one of the leaders in the country. Today, 9 months into 2020, we have provided over 140,000 virtual visits. That is 7 times what we did in all of last year. This has brought telemedicine front and center in our care model and allows us to provide care virtually when appropriate, as well as enhancing in-office visits. We expect to see digital medicine continue to grow thanks to consumer and physician acceptance of this convenient approach. And we will also grow in traditional areas where we'll continue to invest in services that allow you to be in your home and receive continuous monitoring of your health when necessary. This is what we mean when we talk about making healthcare personalized. And just a sneak peek of what is to come in the next decade, one of our cardiologists, Dr. Ryan Mader, is championing research on technology and protocols for performing minimally invasive heart interventions on patients remotely. He was recently featured in a documentary called Speed of Thought, in which he performs a simulated robotic-assisted minimally invasive heart intervention thousands of miles away using Verizon's 5G ultra wideband. This is an important way we can bridge care from urban to rural settings and achieve better health equity for all. So this is what we mean when we talk about making healthcare exceptional. We're amplifying our efforts to better understand the needs of our patients. In August, we opened the Advanced Primary Clinic. This is a medical practice for seniors with multiple chronic diseases designed to help them be healthy and improve their physical condition. This increases their well-being and it reduces the total cost of care. In the first month, we proactively called a patient who had already visited the ER 20 times in 2020. And because of our daily calls, this patient had not visited the ER since. We also call people who have pulmonary concerns. For example, when the air was a bit smoky because of the fires out west. This new approach changes how we interact with our patients and how we are paid. And this is what we mean when we talk about making healthcare affordable. And it's the future of health. We are increasingly focused on that future of health with lifestyle medicine, which emphasizes behaviors and health habits that are among the nation's most important health determinants. Nutrition, exercise, sleep, stress, healthy relationships, tobacco use, and alcohol consumption are some of those health determinants. Especially in the era of COVID-19, more than ever before, we have a better understanding of how unhealthy behaviors compromise our ability to prevent disease and promote health. Because of the lifestyle medicine programs, we know that targeted interventions with specific populations leads to profound changes in behavior and health outcomes. We have begun pilot programs to connect with specific populations, and we're seeing changes in their behavior and improved health outcomes already. The Family Kitchen RX program has already made a significant impact on helping families make improvements to their diet. And in recognition of this important work, it just received a second grant from the Michigan Health Endowment Fund, bringing total support of the program to $1 million. There's also new funding that will help us deliver the program to Spanish-speaking community members. In addition to the focus on physical well-being, mental well-being is a key driver of our health, and it is an acute need today. Taking care of our team members is constantly on my mind and that of our leaders. Thanks to the foundation and a donor who wanted to support our team members, we're now providing our teams with free access to Headspace, a leading online subscription and app that offers meditation and mindfulness support. This helps us relieve stress, anxiety, and improves our sleep. In partnership with Headspace, we also extended free access of this app to patients in many of our clinical areas, as well as to school administrators, staff, and educators. And we will be soon opening a special unit dedicated to helping people with urgent emergent behavioral health issues who come to the emergency department. We've created a 24/7 immediate response team to care for people who have been screened for suicidal ideation. There is so much more to do, and you will see mental health be a major focus for us. Health disparities is a critical issue. A new study led by one of our pediatric intensivists, Dr. Surinder Rajasthakaran, found that Black and Brown children with cancer admitted to pediatric intensive care units throughout the nation have higher death rates than their white counterparts. So this is vital for us to understand why and how race and ethnicity influences mortality. In next month's virtual event, Dr. Raja will also talk about a new study on COVID-19 and genetics, so stay tuned. Two of our most stellar resources that are often behind the scenes have been thrust onto the stage like never before, and that is our infectious disease and infection prevention team and our lab. Our infection prevention specialists met well before the pandemic was declared to prepare for the eventual arrival of COVID-19 in Michigan. They continue to be integral advisors for isolation policies, personal protective equipment, screening, and testing. And speaking of testing, this year we can be especially proud of our lab, which went from performing 0 COVID-19 tests in March to currently 3,000 to 4,000 per day. This explosion of capacity has been possible thanks to new technology, new processes, and creative ways of sourcing testing supplies, all while performing tests in a timely manner. You will see more involvement of our lab as they are integral in caring for our people. The exceptional care we provide is evident in every corner of our hospitals and with every person. At the Spectrum Health Fred and Lena Meyer Heart Center, where we perform more advanced life-saving heart and vascular procedures than any other hospital in Michigan. And our lung transplant program, which is in the top 4 in the nation for 1-year survival rate compared to the expected rate. In our cancer program, we are one of the few centers in Michigan treating patients with CAR T cells with excellent results. This program is named after the Betts family and is providing breakthrough treatment using a patient's own white blood cells to seek out and destroy the cancer cells that are attacking the body. And we're exploring growing research in the area of CAR T cellular therapy today. And at Butterworth and Blodgett hospitals, where our stroke team just received national recognition from the American Heart Association and the American Stroke Association to be published in the upcoming U.S. News and World Report. In addition, our stroke program is leveraging telehealth technology with specialists to improve access to stroke care in our rural communities. And speaking of U.S. News and World Report, Spectrum Health Helen DeVos Children's Hospital ranked among the nation's leading in 8 of 10 specialties in the 2020 Best Children's Hospital, marking the 9th year the Children's Hospital has been included in this prestigious list. The Helen DeVos Children's Hospital has a long list of impressive accomplishments. Our Congenital Heart Center is one of the top centers in the nation, one of only 11 programs in the country receiving the highest star rating from the Society of Thoracic Surgeons for excellence in patient care and surgical outcomes. Our pediatric specialists at Helen DeVos Children's Hospital pioneered a sedation program that is now one of the country's largest. Our Children's Cancer Program and Neonatal Center are among the largest in the Midwest with outstanding outcomes. And then there is the pioneering research by Dr. Caleb Bupp and Dr. Andre Bachman in identifying what was named the Bachman-Bupp syndrome and the discovery that an existing medication might help a little girl in Michigan named Marley and others throughout the world. Marley was born with multiple complex medical conditions and couldn't grow hair. And in just a few short months of taking this new medication, her development improved and she now has eyebrows and a head of hair. This is exceptional and life-changing. These are just some of the major advances we're able to make possible in partnership with you. This is how we will achieve our vision of personalized health made simple, affordable, and exceptional. And this is how we will continue to improve health, inspire hope, and save lives. Since 1997, Spectrum Health has received more than $500 million in donations, and the average donation is $100. Sometimes this support takes the form of a major grant, and sometimes it's pocket change dropped in collection box or dollars raised from local bake sales. All of it is beyond meaningful because it demonstrates that just as Spectrum Health cares about our community cares about Spectrum Health. You are key to our success. Through your selfless support, you stand shoulder to shoulder with our frontline workers. So please make no mistake about it. You are essential. I'd like to share one more example of what we are achieving with your support. Dick and Ethy Haywood's story began with the why that unites so many of our donors. They were inspired to give back because of their own personal experiences and the impactful relationship they formed with us. Their grandson Sam was diagnosed with leukemia as a young child, and Ethy visited him almost every day. And she noticed that when children in the oncology unit would get a shot, IV or treatment, they could pick a toy from the poke box. And she decided she could help by providing toys. And her involvement with our children's hospital continued to grow. Ethy became one of the co-chairs of the Capital Campaign to raise $100 million to build the new Helen DeVos Children's Hospital. This year, the Hayworth family continued their advocacy with a generous gift that is transforming cancer treatment using a new approach to caring for adolescents and young adults. This is care that isn't available for this age group in most areas of our country. In recognition of their tireless support, last month, we named the Children's Cancer Center in honor of Ethy Hayworth, and also named the Endowed Division Chair after someone we all know and love, Dr. Jim Fonner. Dr. Fonner is joining us today to tell us more about the incredibly exciting work taking place at the Ethy Hayworth Children's Cancer Center. I am extremely grateful for Dick and Ethy Hayworth, for everyone that's supporting our organization, and for Dr. Jim Fonner. Jim is the founding physician of our children's cancer program and is the division chief of pediatric hematology and oncology. Jim joined Butterworth Hospital 32 years ago because he wanted to give children with cancer and their families the best possible care right here in West Michigan. Every day, he connects with brave young people like Sam who are counting on us to help them pursue their hopes and dreams. And so it is with great pleasure that I introduce one of our frontline heroes, Dr. Jim Fonner.
Thank you so much, Tina, and thanks to Tim, and thanks to our foundation team for this invitation. And most of all, thanks to all of you for joining us this afternoon for this special conversation. As Tina mentioned, COVID-19 has added so much uncertainty and so many new challenges to our work here at Spectrum Health and at Helen DeVos Children's Hospital. It has been like working truly in a crisis situation each and every day. So how is it that we survive a crisis? How do we get through such difficult times? Well, when it comes to getting through a crisis, I have always turned to my patients and to their families as they are going through the crisis of their lives. In fact, they're going through a crisis for the lives of their children, really. This all came into clearer focus for me in clinic just a couple of weeks ago when the mother of one of my patients stopped me and said, "You know, Dr. Fonner, I don't want to be unkind or anything, but one of my neighbors just really got on my nerves. She was complaining to me about what an inconvenience COVID has been, what a nuisance the masks are, how they're tired of quarantines, tired of the school disruptions, that they had to cancel a family vacation. And Dr. Fonner, I couldn't help thinking to myself, well, welcome to my world." Do you think that my family has faced anything differently than that, going through every day, every hour since learning that my child has leukemia? Masks, quarantines, missing school, but add into that countless trips to your clinic, long hospital stays, bone marrow tests, spinal taps, horrific chemotherapy, hair loss, fevers, nausea. And oh yeah, then there's the part that my child has cancer and may not survive. So to be honest with you, Dr. Fonner, I just kind of wanted to tell her, give me a break. Now, I will tell you, I love our kids and I love our family members. I love our parents because they are so feisty. They are so resilient. They are truly so courageous. I take insights and inspiration from them each and every day. When my wife Gail and I came to Butterworth Hospital now about 32 years ago, it was a very different landscape. Our children's hospital at that time was really a hope and a dream. And most of the children's cancers that I was asked to treat had at best a 50-50 chance of cure. My goodness, how things have changed. But the vision and the mission have never changed. It was the vision of hospital leaders. It was the vision of generous community leaders. It was your vision. And it was certainly the vision of amazing family physicians and pediatricians like Ron Hoffman and B. Murray and Nick Cox and Don Kelly, who at that time, if they diagnosed a child with cancer or leukemia, those families would be thrown into the nearest car or ambulance, even in the middle of the night with just the clothes on their backs, across the state or even out of the state to reach a children's hospital in Ann Arbor or Detroit or Cleveland or Chicago or the Mayo Clinic. But that all changed. and it changed with a gift that would transform children's healthcare in West Michigan forever. A very special gift from a very special couple, Rich and Helen DeVos and their family, transforming us all into what is now our beautiful big blue beacon of hope and healing on the hill, Helen DeVos Children's Hospital. Now, I will tell you today that our battle against children's cancer continues to be shaped and guided by our 4 pillars of care, literally CARE, C-A-R-E. C for clinical excellence, to make sure that each and every child and family has access to the finest healthcare that is available literally anywhere in the world. A for advocacy. As a pediatrician, I'll tell you that it's kind of hardwired into our DNA to be child advocates. Without vote and without voice, we know that children are among the most vulnerable in those special populations that Tina was mentioning that really need our additional care and compassion and advocacy. R is for research. We need to stand ready to learn each and every day from our children and from our families to make sure that we are moving forward with ever improving quality of care. And we only can accomplish that through research. And finally, the E is for education. I will not be here forever. My colleagues will not be here forever. It's vitally important for us to play our role in preparing the next generation of brilliant young colleagues who will be taking over our clinical programs and services here at Helen DeVos Children's Hospital and at Spectrum Health. You will see every day in the hallways of Helen DeVos and Spectrum our commitment to teaching medical students and residents and fellows. And I'd love to tell you that it's our noble dedication to education, but my wife will tell you that it's also a very clever retirement plan to make sure that we have the best and brightest young colleagues who will be following us into leadership roles at this great institution to continue to provide extraordinary care to our children and to our families into the future. Now, it struck me as I was preparing our comments for today that the care, the 4 pillars of care, fit so beautifully with the 4 C's that Tina mentioned, really our core values here at Spectrum Health. The 4 C's that Tina and our leadership team really infuse into our care each and every day. They really are our compass points of compassion and courage, curiosity, and collaboration. And it really makes great sense because compassion, after all, inspires our clinical excellence. Our courage empowers advocacy. Curiosity fuels our research. And collaboration frames our commitment to education. Now, as the new Ethy Hayworth Children's Cancer Center, we are very excited about the future. It is an amazing time here for children's healthcare and for children's cancer care in West Michigan, thanks to the vision and compassion and generosity of Dick and Ethy. As you heard a moment ago, we have a bright future to offer our children and families. From your support of our Port Endowment to make sure that the Pediatric Oncology Resource Team is there to provide wraparound compassion for children and families on a difficult cancer journey, to expand our CAR T-cell program, the wonderful collaboration between our pediatric and adult bone marrow transplant programs made possible through the generosity of Carl and Patty and Ken Betts and their families. Imagine an era where we can actually harness the power of the body's immune system to fight cancer cells instead of having to use chemotherapy and radiation. And finally, the incredible new services that will be provided to a population of patients that has too often fallen through the cracks previously in cancer care, the AYA, or adolescent and young adult population. These 15 to 30-year-old patients diagnosed with aggressive cancers really are a little too old to fit comfortably into the services that are provided in the traditional children's hospital setting, and yet their diseases are distinctly different, and their life experience is in a very different situation from older adult patients. And so they historically have really not had the access to the best possible services, and that is all going to change, because with wraparound supports and with one of our first innovations, which is going to be availability to fertility preservation services, the future will look bright. This whole field of oncofertility is really offered at only a handful of centers in the way that we'll be here anywhere in the country. And so in addition to services for our young male patients, young female patients will also have full access to an array of options for fertility preservation as they complete their cancer therapy and look forward to a very healthy future. Our sincere thanks to Dick and Ethie and our excitement every day as our team now carries on this wonderful care at the Ethie Hayworth Children's Cancer Center. I know that we have some questions to get through this afternoon, so I want to just close with a true inspiration and a true profile in courage. And that is a patient of ours by the name of Scott. Scott came to us at Helen DeVos Children's Hospital just a few years ago as a 17-year-old high school junior from northern Michigan. While he was volunteering with his school class to be a volunteer bell ringer at the Salvation Army kettle outside of the local grocery store, a few days before Christmas, Scott was suddenly doubled over with the most severe abdominal pain that he had ever experienced. He tried to shake it off, but the pain became so overwhelming it was impossible. He thought he might have appendicitis, and so he went to the emergency room, but the diagnosis was much more significant. He had a very serious bowel obstruction and was rushed to Helen DeVos Children's Hospital. Scans there revealed that it wasn't just any type of bowel obstruction. It was something that we call an intussusception, literally a telescoping of the walls of the bowel in on itself, like the folds of an accordion, causing a very serious and high-grade bowel obstruction. He was rushed to the operating room for emergency surgery by our pediatric surgery colleagues, who were able to relieve the obstruction, but who found a confirmation of our worst fears, that the cause of the obstruction was actually a large mass of lymphoma cells, cancer of the lymph nodes, and not only any type of lymphoma, but Burkitt's lymphoma. And I will tell you that pediatric oncologists are a pretty resilient, pretty tough group, but no diagnosis strikes fear into the heart of any pediatric oncologist like Burkitt's lymphoma, the most aggressive and the most rapidly growing cancer in humans, children or adults, with a doubling time as short as 24 to 36 hours. Imagine a cancer that with each passing day, twice as many cancer cells would be present than there was just 24 hours before. So after his successful surgery, Scott began weeks of really grueling multi-drug combination chemotherapy to begin to shrink the remaining lymphoma cells and to make sure that they did not return. And gradually, Scott began to recover, as you can see, even participating in his own care. If you're going to be in pediatrics, you've got to have thick skin, because sooner or later, you're going to be target practice as our kids begin to develop skills to give some of their own medications at home. And Scott's treatment was completed, and he was in full remission in time for him to return to high school as a senior and be named to his high school homecoming court, and to be able to return to his beloved soccer field, where during his senior year, he became an all-district and all-regional player in boys soccer. Fast forward to today, our most recent follow-up with Scott is that he completed his studies at Ferris State in record time and is now actually completing his master's degree in sports journalism, appropriately enough. So with the inspiration of incredible courage and resilience that we see each and every day in patients and families like Scott and his family, it's easy for us to take away our final message today. How do we survive a crisis? We look to our children, and we look to their brave families, and we look to what those components are: intellectual discipline, curiosity, and courage. Certainly in our kids, we see their youthful enthusiasm and their confidence in the future. We know that here at Spectrum Health and Helen DeVos, we have inspired people leading inspired teams. And Tina, I'd add an asterisk to that and say that it's really inspiring people leading inspiring teams, because we are surely inspired each and every day. And to all of you who are joining us today, and for all of your extraordinary generous support, we want you to know that you are not only part of our extended team of caregivers, you are really part of our extended family. And what you are providing for us, even through the most difficult times, is our margin for excellence and our margin for innovation, to make sure that we will always continue to bring hope and healing into the lives of children, adults, and families who are entrusted to us for care. Thank you.
Well, thank you, Tina and Dr. Bonner. I was reading the comments on social media as we were going through this, and there's a common theme and a word that's used over and over again. It's amazing. It's amazing to see the kind of pediatric care we have right here in our community. And thank you both for a great presentation. Now I'd like to open it up for questions from the audience. Again, all you have to do is make a comment on the social media platform that you're using, and those will be fed through. So I have a question here from Mary for Tina. And Tina, the question is about the COVID vaccine. Is there any insight you can give us on that?
Well, thank you. And Jim, fantastic presentation. Thank you so much. And I agree with you. I love the inspiring teams and inspiring people and the work that we're doing. And every day it is about how do we improve health and inspire hope and save lives. So when we talk about the COVID vaccine, I'm just amazed at all the developments that have gone on in the short 6 months with the pharmaceutical companies. What we are really focused on is wanting to make sure that there's a safe and effective vaccine. And so we're monitoring that on a regular basis. Our focus right now is getting prepared to help with the distribution, which will be very significant because there are a number of vaccines and they require different things, such as different temperatures to store them. Is it 1 shot or 2 shots? And recording that and then connecting it to the people that we serve. So we're staying on top of this to understand what the vaccines will be, their efficacy and the safety of them. And we'll probably have more information to share about a vaccine at the beginning of 2021.
Great, thank you. Dr. Bonner, we have a question for you. What's the biggest advancement in cancer care that you've seen over your career serving the community and at the hospital?
Oh goodness, it's such a tough question because it's been a multifactorial. I think truly one of the miraculous success stories of modern medicine. As I mentioned when I first arrived, with some of our cancers having at best a 50-50 chance at cure. Now the great majority of children's cancers have 80, 85, 90% cure rates, which is absolutely extraordinary. Certainly the availability of comprehensive multidisciplinary teams of specialists working together, as you have helped us assemble here at Helen DeVos Children's Hospital, is absolutely essential. We never do anything individually. I work with a wonderful, wonderful team of the world's best colleagues in pediatric oncology and an extraordinary team, but it really is the specialists in those other areas to be ready in the emergency department, in our intensive care units, our infectious disease specialists, our kidney specialists, our GI specialists, all working together on these extremely complex patients. And within the team, also, it's never just the physicians, it is our nurses, our social workers, our child life specialists, our pharmacists, the technicians and technologists, our research staff, who are all working together. So I would say it's the ability to bring clinical research trials safely and quickly into the lives of our children and families that have really been responsible for these breathtaking advances in the positive outlook for children with cancer.
Tina, a question for you. These are uncharted territory for all of us in the COVID era, but what are some of the biggest challenges that hospitals are facing in this time?
There's a number of challenges. I never would have thought that we stopped services last March and kind of pivot and stand up for a pandemic. I think the biggest area and the one that I'm pay attention to every single day is how do we do the best for our team members. I think about their health and their well-being. I think about what can we do to continue to keep them safe, that we have programs, like I mentioned, for Headspace, for their mental well-being, that we have programs to help with physical well-being, because we are so reliant on them. And I am extremely appreciative of what they do, what our team members do every single day. So keeping our teams front and center is what I think about all the time. And I think that's an area where we can all come together. And we need to make sure that our culture of Spectrum Health and our culture of exceptional care and coverage continues to go as we interact with each other wearing masks or we work remotely. And so that's what I focus on, and that's an area that I see as an opportunity, but also as a challenge.
A question for you, Dr. Bonner. There's always continuing needs. Right now, with pediatric hematology and oncology, what can donors do to help with today?
Oh, that's a great question, and we're so grateful for it. And there's not a day that goes by that we aren't reminded that philanthropy and the generous support of our community has truly been the beating heart of Helen DeVos Children's Hospital, as it has been throughout the Spectrum Health Center with the Meyer Heart Center and the Ledenga Cancer Center, the Lemon Holton. It's just remarkable, and I just want to express to our supporters and donors how vital that work is and how it is noticed each and every day at the bedside, on the wards, really hour by hour here at the Children's Hospital. There are always needs in our supportive care areas that sort of come up alongside our patients and families at the most difficult time in their life and support them in a way that gets them through a childhood cancer journey somehow intact, not only the child, but the extended family and siblings. So our work on our endowment fund for PORT, the Pediatric Oncology Resource Team, could certainly use that support, as well as our Child Life services. And Child Life is now expanded into so many additional vitally important services that provide music therapy, educational liaisons for our children and families who are in hospital for an extended period of time, our pet therapy, our art therapy. Those areas are always very valuable. In addition, the support that is able to be provided to our families from great distances at our Ranucci Hospitality House and its special letting of floor for our bone marrow transplant families. There are always unmet needs there as well. And these are the families that now, from great distances across West Michigan and beyond, across the state and now across the country, and sometimes even around the globe, who are referred into us as a center of excellence for children's cancer care and are far away from home and are tucked safely and securely into the services of the Ranucci Hospitality House. It's a wonderful opportunity there. We miss our upfront volunteers. It's a tough time with COVID and with our quarantine and with our safety restrictions. So not actually seeing our volunteers on site as part of the vibrant day-to-day life of our Spectrum Health and Helen DeVos Children's Hospital family has been tough. But we want to hear from you. We want to stay in touch with you, and there's still very much that you can do to help.
Tina, I have a question for you. This may be one of the toughest questions you can get. What are you most proud of as the leader of Spectrum Health?
Oh, I love this question. I said before, I am so proud of our team. You know, the things that Dr. Fauner just talked about, we can't do that without our people. And what COVID really highlighted is that every single person matters. And the people that are providing care at the bedside or in the clinic, our nurses, our physicians, our the caregivers, and then those behind the scenes that really do make a difference. We saw with COVID, everyone came together and knew just how to contribute and where it went. And by their innovation, by their collaboration, by their curiosity, compassion, and their courage to face these challenges. So I am most proud of our team, and it gives me such confidence to know that where we're going in the future to get to our vision of personalized health made simple, affordable, and exceptional, that I know they have this, and that we're pushing every day to be innovative and to achieve that goal, because it matters. It matters to each of us. It matters to our community and to our neighbors. And so this is what drives us every single day. This is, I think, why Dr. Jim Fauner always has a smile on his face.
Dr. Fauner, a question for you. I know you gave us some overview, but what programs and services are now offered at the Effie Hayworth Children's Center that weren't previously offered?
So much exciting innovation that's in store for that very important group of patients. And I think the three that immediately come to mind, one is to really guide the teen and young adult patient through care in much more age-appropriate and innovative ways. And we're going to do that through piloting a concept that really doesn't exist anywhere in the country. You've heard of our Child Life specialists. Well, what about an AYA life specialist to provide some of those same connections? We're looking into that, and we're very excited. We also know that clinical trials for childhood cancer has been responsible for the great advances we've seen in the improved cure rate for virtually every form of childhood cancer. And yet, for a variety of really complex reasons, The AYA population, the adolescent young adult population, is very statistically underrepresented in clinical trials. So we need to make sure that clinical trials are being presented, explained, and available and accessible to the AYA population in some new and creative ways, working with our research staff to make sure that's available. The program that we're rolling out even as we speak, I was just hearing an update before we came online today that we're very excited about, is our Oncofertility or fertility preservation services. You know that without getting too graphic, for many, many years, older male adolescent and young adult patients did have some sperm banking options, but fertility preservation interventions for young women were almost unheard of. And so we are going to be really on the leading edge of providing a variety of different options and services for our young women to make sure that if they are receiving surgery, chemotherapy, or radiation that we know will put them at very high risk subsequently for fertility issues, that we will be able to meet with them as a team before they even begin their therapy, go through their various options for fertility preservation, and then make those interventions available to them. It's a powerful message to a young adult. It's one thing for us to say, we believe you will make it through this cancer journey. We think that there's a high chance of cure. But what a powerful message it is for the team to come in and, after learning that devastating diagnosis, to say, now we're going to talk to you about what happens after. And we're going to do that in a really important and compelling way. We're going to talk about your future family planning and your future fertility issues. That confirms for all of us that there is genuine hope and there is the genuine expectation that there will be a positive and healthy life beyond for our young adult cancer survivors. And it's going to be very exciting.
A question here. Are there plans to expand the music therapy area, which is an incredible service? Any idea on that?
We're looking to do that all the time, and Bridget and Katie and some of our music therapy team that I know are well known to many of you out there and who are just beloved because of the incredible services that they have brought to our children and families. They have already started a student and fellowship program to make sure that they are involved in themselves, training the next generation of music therapists who are here on site to do their training period with our wonderful team, and then we'll go out. But just to provide the amount of coverage we'd like to have, both inpatient and outpatient in all of our clinics throughout the program and all of the different floors, those remarkable ladies are stretched pretty thin right now. So the opportunity in the future to expand those services and make more of them available, we're really looking forward to that.
Tina, I heard you talk about robots, 5G, and I know in 2020 it's hard to predict the future, but where do you see things going over the coming years with technology and healthcare services for Spectrum Health?
Well, I see it continuing to grow, but the beauty that we'll have to create is to make sure that as we use technology, that we still have that caring touch with it. Because we're really about people caring for people. And so we'll use the technology services to allow us to make it more convenient, to make it more affordable, and to really connect with the ways that a patient or consumer wants us to do so.
Well, I don't know about the audience, but for me, this has been very enlightening. I thank you both for your time today, for enlightening us with what's happening now at Helen DeVos Children's Hospital and Spectrum Health. And we look forward to the series and learning more of all that's going on with Spectrum. I'd like to thank the audience for stopping in and joining us today and fielding questions. And it's been a pleasure being with you. And we've kept it on schedule. And thank you, Dr. Fonner. Thank you, Tina.
Thank you.
Thank you.